Hello everyone, welcome to a new video. In this video I am going to focus on a topic called as sulfonamides. So basically sulfonamides refers to sulfur drugs. They contain a group of they are the group of synthetic antibiotics that contain sulfonamide functional group. They are used to treat various bacterial infections. And regarding the chemistry of sulfonamides, so the sulfonamides are the sulfur drugs have their own characteristic chemical structure that includes sulfonamide functional group. This group consists of sulfonyl group which is connected to a amine group. The general structure of the sulfonamides is as follows. Here the letter R represents an organic group which can vary leading to a different sulfonamide compounds. In more detail, the sulfonyl group has a sulfur atom which is double bonded and it is connected to two oxygen atoms. The amine group, that is NH2, is bonded to the sulfur atom. This structure provides them ability or capacity to produce the antibacterial activity. And sulfonamides, the mechanism of action we will study in detail in the next slide. Now, what is the mechanism of action of sulfonamides? How they are going to produce the antibacterial activity? So when the sulfonamides competitively bind to the folic acid synthetase enzyme, and then it causes inactivation of the folic acid synthetase enzyme. This will leads to inhibition of the folic acid synthesis, means the folic acid synthesis is not produced due to deficiency or due to inhibition of synthesis of folic acid. That will leads to death of the bacteria, that is it will produce the bacteriostatic action. Here is the classification of sulfonamides. The sulfonamides are classified based on their duration of action into three categories. First one is short acting sulfonamides. Example, sulfamethaxazole, then sulfadiazine. Second one is intermediate acting sulfonamides. Example, sulfamethaxazole. Another one is long acting sulfonamides. Example, sulfamethaxopyridazine and sulfadoxine. The next one is some sulfonamides are used for topical use also. Example, sulfacetamide, mefanide, then sulfadiazine. Then antibacterial spectrum of sulfonamides means sulfonamides are effective against many gram-positive and gram-negative bacteria, including streptococci, then H. influenzae, staphylococci, meningococci. Uses or applications of sulfonamides. So sulfonamides are used in various bacterial infections like urinary tract infections, conjunctivitis, malaria, then ulcerative colitis. Now, what are the commonly seen adverse effects of sulfonamides? So they may cause renal irritation, they may cause rashes, they may cause fever, nephritis, nausea, and they may also cause abdominal pain, and it may lead to hemolytic anemia. So these are some adverse effects of sulfonamides. Now, what is cotrimaxazole? See, cotrimaxazole is nothing but it is also a sulfonamide, but it is a combination of two drugs, that is trimethoprim and sulfamethaxazole, and it is effective against gram-positive as well as gram-negative organisms. Now, what is the dosage of sulfonamide drugs? So we will see one by one. So, for example, sulfadiazine. So in the adult and teenagers, it can be taken up to 2 to 4 grams for the first dose, then 1 gram every 4 to 6 hours. Whereas in case of children which are from 2 months and older, 75 milligram per kg of the body weight for a first dose, and then 37.5 milligram per kg of the body weight every 6 hours, or 25 milligram per kg of the body weight every 4 hours. Then sulfamethaxazole. In adults and teenagers, it is taken up to 500 mg to 1 gram every 6 to 8 hours. Whereas in case of children 2 months and older, 7.5 to 11.25 milligram per kg of the body weight for every 6 hours. Then sulfamethaxazole. In adults, it is taken 2 to 4 grams for the first dose, then 1 to 2 gram every 8 to 12 hours. In case of children about 2 months and older, the dose is based on the body weight.